Right. So this was a phase 2 trial that has been already published. The primary endpoint was the total cumulative number of gadolinium-enhancing lesions in MS, in relapsing MS. And it had shown that there were statistically significant differences with Evobrutinib versus placebo. So the way the trial was designed is that it had 5 arms. So one was placebo, the other one was 25 milligrams every day. The third one was 75 milligrams every day. The fourth one was 75 milligrams twice a day of Evobrutinib. And there was a reference arm with dimethyl fumarate, with the approved dose for dimethyl fumarate. So at 24 weeks, we met the primary endpoint. But we also saw that there was a very dramatic reduction in relapse rates. And we continued the study for another 24 weeks, then for a part of the study that was still blinded, but everyone was maintained in their original arms. So those on 75 QD were maintained for another 24 weeks on 75 QD, and so on, except for the placebo arm, where these patients were moved to 25 milligrams QD. So now we have data not only at 24 weeks, but also at 48 weeks. And at 48 weeks, we saw that the effects that we had seen at 24 weeks that were very drastic with ARR were maintained. So after 48 weeks, we moved patients to the open label extension phase. And in the open label extension, everyone transitioned to 75 milligrams QD initially. And then they were moved to 75 milligrams twice a day, BID. And again, after 108 weeks, we saw that the very high efficacy in terms of relapse rate reduction, where we saw that from an original placebo rate of 0.37, the ARR, the annualized relapse rate, had come down to 0.11. It was maintained to 0.12 at 108 weeks. So for an additional 60 weeks following the original 48 weeks. So these, of course, gave us all the impetus to believe and implement a development program that is aimed at comparing Evobrutinib with another agent in the market, that is teriflunomide, another oral agent in the market. So we have 2 large phase 3 studies in relapsing MS, which are, double-blind, randomized, controlled studies against teriflunomide. So the studies are launching in the middle of this year. And typically these studies take about 3-4 years to complete. When all is said and done, for the data to be processed and for submission to the regulatory authorities is around 3 to 4 years. So we are very excited because we know that the drug works on both B cells, which have been shown to have a central role in progression of MS, and on macrophages. And that includes other myeloid cells like resident macrophages in the brain. Those are the microglia, which have also been implicated in the late stages of MS. So this creates an avenue for us because we have a small molecule drug that is an irreversible and highly selective covalent inhibitor of BTK. And BTK plays a very central role in the inflammatory potential of both B cells and microglia or macrophages. So we know also that the drug is very selective. So it's that creates the potential for very little adverse or off-target adverse effects by the drug. And we have data as well in animal models showing that, the drug penetrates the blood-brain barrier. So we are extending that information to include human studies as well.